Welcome to 4 Quarter Lives, a podcast exploring the profound impact of longer, healthier, and more engaged lives, not only for ourselves and our couples, but also for companies and countries. I'm Avivah Wittenberg-Cox, and on this week's 4 Quarter Lives, I talk with Amanda Philpott, founder and CEO of a startup called Eargym. After 3 decades in the NHS, Amanda's personal and professional journey led her to an unexpected passion: hearing health, yours and mine. With the launch of Eargym, she's not just talking about preventing hearing loss. She's pioneering a way to train your ears and protect cognitive health for life. We'll explore why hearing is often the forgotten sense, how Eargym is gamifying auditory care, and what Amanda has learned on her own inspirational Q3 transition from public service to startup founder. So today I'm delighted to welcome Amanda Philpott. Welcome to 4 Quarter Lives.
Hello, how are you, Avivah?
Very well, and all the better for having you with us to share some of what I have learned from you and look forward to sharing a little bit with others. So first, we'll talk about your startup called Eargym, which is a great name, and a little bit about the backstory. What inspired you to focus on hearing health? Why that, of all the choices and experiences you've had? And how did that lead you to create Eargym, this new startup?
Certainly, I'll try to keep the story short. It's a little bit long, but I'll shorten it as much as I can. I spent a long time in the English NHS in management, and I was a commissioning chief executive. So that's commissioning services for the local population. And I had a huge commitment to prevention. And some of the financial pressures on the NHS mean that we spend an enormous amount of the budget on reactive measures and on treatment and on hospitals. And in my view, we weren't spending enough resources on prevention in the first place. And, that's not blaming anybody, but it was something that I found that I wasn't operating in my area of passion.
And you're not alone. I mean, everybody from Andrew Scott to the head of the medical services in the UK is calling for a shift from treating sick people to preventing healthy people from getting sick.
No, I mean, you're completely right. And the politics of the NHS and a tax-funded service is really interesting. And certainly I think back in 1997 was the first 10-year plan I worked on for the NHS. But nevertheless, as a chief executive, you're managed on an in-year financial surplus. And so that makes it quite difficult to prioritise investment in prevention when you're working on a within-year rolling basis. So love the NHS. I think people working within it are fantastic. I made some great friends, but the system can be quite frustrating if you are trying to tackle population health. And so I decided to leave. And
you spent a long time. I mean, this was not a sudden decision. You've spent 30 years there. Is that right?
Yeah, well, 28, yeah. So I was in my early 50s, and you might have thought I would carry on through, for the rest of my career. And as I said, I loved it, but it's quite a challenging place to be. There's no easy answers. It's a complex world. I know millions and millions of people across the world work trying to get health and social care policy right. And the government set up, around 2010, it set up the Industrial Challenge, which was about getting local universities, local industry, and local public services, health and care services to work together to bring innovation into the NHS. And particularly that was around older people. So I was working on that. When I left the NHS, the academic institutions I was working with said, why don't you try to do this then? Put your money where your mouth is. Go and join the Zinc VC Accelerator, which is about building businesses that could improve the quality of later life for 100 million older people. And I thought, well,
good challenge. Yep.
Yeah,
okay.
Yeah, fair challenge. So I applied to Zinc and was lucky to be accepted, and found myself on this program, which was about building startups. So a whole new world for me. And in their first month, they invited a load of experts from big organizations and from charities and big providers and what have you, and from user experts. And one of the experts was from the Royal National Institute for the Deaf. And she spoke for just an hour, and she spoke about the prevalence of hearing loss. And she spoke about its correlation between a hearing loss, social isolation, mild cognitive impairment, and dementia. And she explained that hearing loss is the biggest amenable factor in dementia, the biggest thing we can do anything about, 8% of all dementias. and that even mild hearing loss can double your risk of dementia.
Which is like probably news to a lot of people.
Oh, yes.
This is like, absolutely. We have not heard this, and I just want to underline that this is, I think, the shocking detail that you have shared with me, that is, if we don't catch hearing loss early, our brains start to disintegrate. Is that a layman's version of what you're discovering?
Yeah, and your point about shock is right. I mean, I was sitting in this meeting and I would pride myself on being a population health specialist, and it was all new news to me. I don't recall ever spending any money that I was responsible for on prevention of hearing loss. I don't remember spending any money on primary care, so community-based hearing care. So I was listening to that. And also the dementia diagnosis rate is, in my view, relatively low at about 65%. And it's a big challenge. And one of the reasons for that is that we don't really know what to do. When we diagnose somebody with dementia, are there appropriate services to refer people to? What do you do other than raise alarm and concern? And so it was the twin set, really, of I'd missed this massive public health issue with huge prevalence, 430 million adults in the world living with a disabling level of hearing loss, and more worryingly, another billion living with mild hearing loss, and then another billion young people aged 12 to 35 at risk because of our use of headphones now, because of our noisy worlds. So we're storing up this massive long-term cognitive well-being challenge if we don't look after our hearing and raise awareness of the importance of looking after our hearing. So I sat in this...
And of linking those two things, I mean, quality of hearing and cognitive decline. I mean, those are the two words you really want to take away from this podcast, dear listeners.
Yeah.
As soon as your hearing goes, so does your brain.
Well, yeah, very much a strong risk. And it's logical, isn't it? I mean, regardless of the science, and science is there, but it's logical. If you struggle to hear in those noisy environments, you find your bars, your cafes, your restaurants, the places where you meet your friends and networks, you start to step back from them. You start to find yourself more isolated. You start to feel lonely. It's a really logical impact on the way in which your brain works. But also what happened was, there are some fairly basic questions to think about. Do the people that you perhaps live with say that you have the television too loud? Do you struggle to hear on the telephone? Do you find it annoying when you're trying to hear in a crowded place? Are you tired when you've been struggling to listen for a while? All classic signs of hearing loss. And I thought, well, that's my parents, And then we talked about the correlation and the impact and the risk around dementia. And my father, sadly, his birthday today, as it happens, it would have been, but he died last year with dementia. Now he was 92, but his last few years in life were very distressing for him and for us. But he also spent 20 years before that with unaddressed hearing loss. And now I can't say that if he'd worn hearing aids or he'd addressed his hearing, he wouldn't have had dementia. But the fact that he might have had a better experience is something that sits deeply within me. So I have both a professional and a personal interest. And then when I was thinking about all of that, I realized, of course, that I could answer yes to most of those questions in my early 50s.
Me too. Yeah. Me too. I can't stand noisy restaurants and never go there anymore.
Absolutely. So now I wear hearing aids and my world is a lot better. But yeah, it's quite a challenge. So that's why I'm in hearing. Long answer. I apologize for that at the beginning.
So let's figure out, how does Eargym work? And it's not a hearing aid. And explain to us what exactly is auditory training and how does it benefit us?
Yeah, so Eargym is it's a digital health app. And so we offer a suite of hearing checks and auditory training games, and then advice and guidance on what to do if your hearing really could do with some face-to-face specialist support, your high street audiologist or your general practitioner. And the reason that we have set that up is so that you can access your hearing care at your own convenience in an affordable, accessible, private way using your own smartphone and your own headphones. And you can I've tried this. So you just download the app, you put in your little earphones, and you can actually get an ear test free. Yeah, that's it. Yeah. And the checks that we use are what we call speech in noise. So we assess your ability to hear speech in noise and make sense of it, which is kind of an important measure when it comes to what we anticipate our cognitive impact to be. So that's the experience, and we encourage you to train 3 to 5 times a week. And the games, which we've built in-house, are about practicing your hearing skills. What we talk about is, can you detect the sound in the first place? Can you locate it? Can you discriminate it from other sounds? And can you apply meaning to it? So it's all very well, it was described to me by all the professionals we work with that if you're in the woods and you hear a sound coming towards you, do you know where it's coming from? And do you know if it's the bear coming to attack you or it's the wild boar that you want to eat? Applying meaning is really important. And that's part of our cognitive process. So that's what we practice.
What I'd also like you to explain is what I had not quite understood the first time I heard you is that training your hearing is something you can do even before you experience hearing loss. It's a muscle that you train so that if you start a little early, you might delay the actual loss of hearing. Is that right?
We are certainly in that field where it's what we call performant hearing. So you will have a level of hearing that you can maintain if you practice listening, as well as a level of hearing, if you have some decline in your hearing, the opportunity to improve that level of decline. And so it is worth, there's a few things that you should and could do anyway to look after your hearing. If you're already, if you're living with good hearing now, then now's the time to turn the volume down. Now's the time to say, the rule is 60-60. Have no more than 60% volume, and every 60 minutes take a break, give your ears a rest. Wear gig plugs, wear ear defenders. Gig plugs are great because you still hear all the music. You just take
what are gig? So, okay, I'm out of this. I'm not a 20-year-old rock aficionado. So what are gig plugs, I assume?
So, those little foam earplugs, you get on airplanes. Well, there's a slightly more sophisticated version, which is made of a sort of silicone, and it has some filters, but the same sort of shape. And you put those in your ears, and the filters take out the distortion in the air, of the noise in the air. And what it means is if you're in a typical gig or club, you might be listening to sound at 110 dB or whatever. You can take down the volume through these gig plugs by an average of about 17 dB, which means that you can do safe listening. That goes from about 15 minutes of safe listening to about 2 hours of safe listening. So, and the other thing from a musical perspective is that you don't really lose the musical experience because you still hear it, but you've got rid of that tinniness. And they're good things to have, attached to your key ring so that you can, if you're in a road environment, there's a big construction site next to you, all of those things, stick your gig plugs in. And it just protects your hearing for longer than you might think.
So I'm struck by how much this particular service and topic isn't just for older people, which is where we expect it to be. She's old, she's losing her hearing. You're actually warning much younger people who are making themselves kind of ill by overexposure to noise, that they better start protecting themselves right away.
Yeah, my hearing loss it's partly age, but it's predominantly because I used to have a very noisy lifestyle. I used to come out of clubs with that ringing in my ears.
Yep.
I used to listen to, in the car, I used to listen to music on full volume, and I was quite into, heavy metal and what have you. And I didn't think twice about looking after my hearing. And what I now wish is that I had just turned the volume down and been a bit more sensible. I didn't realize at the time just how important our hearing is as a sense. And actually that's echoed even now. 1 in 2 of us will check our sight every year or have our dental check, but only 1 in 20 of us will check our hearing. And if you think about it, I know that I can read with my glasses on, and I know I can't read without my glasses, but I don't know what I can't hear if I've lost my hearing gradually.
Is that why that sense is so overlooked? Because it's not just so easy to measure its loss?
Yeah, I think so.
It's kind of slow, I imagine, so you kind of don't notice the decline.
That's right. I can still hear birdsong without my hearing aids in, and I live in the country and I love going out on country walks, and I hear 4 or 5 birds. And then I got my hearing aids and I went out, and it was like the birds had put on a concert for me. And I then realized that I had lost probably 80% of birdsong because it's quite a particular pitch, but I didn't know it until I reheard it.
So you talk about gamifying this auditory training that Eargym offers. What does that look like? How does it work?
So the reason that we've gone down the route of gamification is because we recognize that some of the reluctance to check our hearing is to do with a fear of frailty. So the average age of a first-time wearer of hearing aids is 72. And that means that maybe a half of the population is experiencing hearing loss by then. And so if the average age is 72, that means that there's quite a long period, build-up period, where more could have been done to help prevent the rate of decline, but also to help manage the symptoms. And so we did a lot of user testing on why people were not checking their hearing and why people were frightened of appearing frail and what have you, and what the barriers were. And we found that people didn't want to medicalize it. Yep. They didn't want to have a frailty problem. They didn't want to be diagnosed with a condition. So we very deliberately went about setting up Eargym as something that you can access in short periods at your own convenience, but also that you would want to use, that would entertain you, that would make you think, actually, it's a bit like learning, one of those language apps or a meditation app. It'll take a few minutes of my day and I will feel good afterwards and I won't feel like I've done a task. And so that's why we went down the gamification route. There's so much to learn, isn't there? Just whether or not games are for good or just for fun. There's such a lot to learn about how you get people to want to engage with them. And so that's the best way forward. What that also enables us to do is collect data over time. So if you check your hearing with us quite regularly and you train quite regularly, we can see on aggregate what happens to populations, whether or not they're younger or older or men or women or living in different places, what their heritage is. And that contributes to the science. So we wanted to do something that would get people to engage regularly. That's why we went down the gamification route.
And what are some of the trends? Have you got enough inputs now to start seeing what some of the trends or interesting surprises that have come out of this research?
Yeah. Let me think. Gosh, we set up in this thing about barriers to looking for our hearing. We recognized that people's sense of free time and wanting to prioritize hearing checks was a big barrier. So we set up a little 30-second, it's a frequency slider, and we call it an ear age check, because every decade in our lives, we will lose a little bit of frequency. And so we can give a rough indication of your ear age, if you like, with this very easy, very quick ear frequency slider. And we only set that up just to get people to think about their hearing. And it's accurate enough, but we don't claim that it's a scientific check, but it's a good indicator.
Yep.
And we thought that would be interesting. Well, we've done something in the order of 550,000 checks. And what's most interesting is that half of those people are aged under 24, 70% are aged under 35. So we know that actually the fear of frailty that older generations have around admitting that their hearing might be fading is not something that is being maintained in younger generations. I think because we think rather the indications are that because younger generations are more used to having something in their ears or wearing headphones and what have you, they are less frightened about the perception of using hardware and looking after their hearing in their ears. So that's been one.
And they don't think it's the beginning of a long decline, that's inevitable the way some of us at a slightly different age might think, oh, there we go.
Yeah, or maybe they are thinking about their hearing earlier because they're using their hearing very actively and, with their phones and their music and they're, blocking out people on the underground and all of that stuff. So that was one. The other is an important part of what we have is our data. So we've got probably nearly 100,000 training minutes. So we see the impact of how often do you need to train to see a measurable improvement and by what. And we see who is interested. I mean, this is really interesting. Who is motivated to check their hearing? When are they motivated to check their hearing? And why are they motivated to check their hearing? And that's really interesting. And that, for us, as an impact company, is something that's really valuable to the public health sectors across.
So can you share some of what you've discovered in that kind of journey?
Yeah, I guess. And there's so much, what can I say? Younger people like to check their hearing in the way that, we wear fitness watches and what have you. They will
I noticed that the Apple Watch gives you lots of warnings about noise around you and things like that. I imagine that's helped stimulate the appetite for checking your hearing.
Yeah, I mean, Apple are doing some very interesting things. Hearing aids are medical devices. There's some really amazing tech and some great research that have gone into them, but they, generally speaking, will cost £2,500 a pair to whomever pays for them. The Apple have recently announced that their new AirPods will be hearing aids, and obviously they're at about a $300 price point, I think. And that's a very different entry.
That's disruptive.
It certainly is. And it's going to be, I think what that signals is that a lot of the hearing hardware manufacturers and a lot of the influencers, if you like, are seeing the importance of looking after our hearing. And we're seeing that, I think, in the proportion of younger people that are checking their hearing willingly, proactively seeking us out to check their hearing, because that's been a significant finding for us. And then we get an age group.
It's really going to get rid of the age-relatedness of this issue, isn't it? Yeah.
Yeah. I mean, I think it's a really important signal. It would be very interesting to see how all of the audio industry and all of the hearing industry responds. I mean, because there's also a really interesting challenge that was put to me the other day, which is if your headphones are actually your hearing aids, but it looks to me like you're listening to music, will I feel engaged in the conversation? And, I think there's some really interesting behavioral challenges around how we look after our hearing and how we signal our hearing, or whether or not we've got assistive devices. Other things are people aged around 45, we see wanting to train their hearing. And then possibly because they're at that stage in life where they can see that they may not live forever. And also maybe perhaps they're seeing in older generations the impact of unaddressed hearing loss.
Yeah.
And then we have an older age group and a group of people like me who probably notice that they've got a fairly high degree of hearing loss, where if you've left it too long to get assistive tech, then your brain hears sounds it's not used to. It can be a bit of sensory overload. And so what we are also seeing with Eargym is sometimes when people are getting new tech, like newly using hearing aids, for example, that they are using Eargym to train, to practice, to become used to it rather than just reject them outright. So we're seeing these three groups, which is handy. It's interesting to see.
Fantastic. Really fascinating. And it will be interesting to see if there's a complete fusion of sectors between health and the music kind of industry.
Yeah.
That would be a way to de-medicalize the whole issue.
Yeah. Hearing is definitely coming to the fore. It's definitely a really significant area of development that's been very underserved until now.
Fascinating. So I want to switch gears slightly because you yourself are a bit of a role model of transitioning from one very long first career to an entirely different one. So I wanted to see if you would share a little bit, because many of our listeners are aspiring transitioners or accomplished ones. 30 years in the NHS and then off into changing gears in the startup world. That might have been quite a jump. Can you share a little bit how you've experienced it? Was it a wild ride, good fun, or something?
Yeah, it's. I sometimes think, goodness me, what on earth did I do? But it's brilliant. The initial joy of it was learning a whole new world because, every industry has its own language and its own ways of being and its own hierarchies and things. And so I stepped out into this world and I had to literally learn a whole new language, I think, insofar as I would sit in the early days of Zinc and, people talked about B2B and B2C routes to market, to business.
It's a whole vocabulary. It's a language.
Yeah. And they talked about, I learned about all these different roles that you have in tech companies. I was learning more about click-through rates and what have you for software companies and lifetime value and all these things that I didn't think that weren't part of my previous career. And I was sort of I remember sitting there writing notes or typing away on my computer, just, listening really hard and actually going home and doing homework in the evening to find out what I'd been learning about, But then learning so much about how investment works, because we are half equity funded and half research grant funded. And I'm quite comfortable in the world of research grants. But equity investment is a very interesting and very challenging world to be in. The statistics are terrible, really, insofar as any investor will see 3,000 decks in a year. They will invest in 10. One of those will be run by a woman. 3 of those might be run by a mixed co-founding team. But when you understand the maths, then you then also have to understand the kind of investors, what an investor's investment thesis is, and what their maths are, what their expectation of a return on investment are. And that, again, was quite an eye-opener to move from a public service-funded career with long-term budgets, albeit managed in a particular way, to building a business from scratch, having to ask people to invest, had to ask family and friends to invest, and then go out to professional investors. And then, obviously, you do everything yourself again, so you go back to basics in terms of the start of your career. You're back at the start of a whole new career. And that can be both refreshing and also daunting. And I have really, really loved it. But I've been in a meeting with my co-founder today talking about our next steps. And we talk about, Andy, my co-founder, is an ex-DJ, and he had a career in digital products and has worked with big brands and things. And the two of us complement each other from our different perspectives and our similar and shared ambitions around hearing care. But we would describe it, the life of a startup, as a triumph of, you've got massive hope and massive troughs of despair and not a lot in between. There's not a lot of mediocrity on a day, but neither would we have changed it for the world.
Yeah. A whole new lease on life that keeps you challenged and invigorated, it sounds like.
And I would say if I'd wanted an easy life, I'd probably have stayed in the NHS because it was nice to have a reliable salary, something that I understood. But I do have a good time doing what we're doing.
So how did, you had a particular role at the NHS, seeing the commissioning side. So how did your background in public health and that kind of approach to seeing what got developed help you approach this industry and hearing health in general?
One of the most important things, I think, in any consideration of developing health and wellbeing products is the economic return. So I think there is a lot of innovation that's really interesting, but it's not necessarily addressing a problem that anybody has, insofar as it might be a great product, but it will always be a challenge if we don't understand how many people are going to benefit from the product and whether or not they will actually want to benefit from the product. So
and whether they'll pay for it in the end.
Yeah. And is it meeting a need? And so for us, I think what was useful from mine and Andy's perspective around Eargym was understanding that the size and scale of the problem and the acknowledgement of these superb companies that are in the hearing hardware, if you like, and the retail audiologists and what have you, demonstrate that there is a need, but we could also see there was a massive unmet need in that market. And then understanding the need for an economic return to any payer, whether or not that's an individual or an organization or a government, is something that has underpinned our understanding of the price. How complicated is our solution going to be? And how do we make it as widely accessible as possible? And I think the third element, which is possibly an odd one, is that I have been very clear that we are not going to sell to the NHS until such time as we have income streams that mean that it is a conversation that we can have constructively and over time, because large health systems are large and complex beings, and you can kill a startup by getting drawn out in the procurement process. Yeah. And so some of my most useful experience is knowing what not to do as well as what to do.
And the timing of when to address those things and what goes first. Fascinating. Yeah, really, really interesting. So we'll know that when you hit up the NHS, it'll be because you've already built a steady income stream.
That's right. Yeah,
that allows for your financing. How did your background in the NHS also just nourish Eargym's mission and even its business structure?
Yeah, we are an impact business. And one of the joys of meeting Andy on Zinc and deciding to build Eargym is that we had a lot of conversations before we decided to build the business together about what motivates us. And we are both motivated by having a massive impact. And both wanting to be really significantly improving world health. Yep. And we both have experience of aging parents and aging families, and we thought that was a really good thing to go after. And so we, from a very early stage, decided that we needed to signal that we were an impact company. So we deliberately went down the path of becoming a B Corp, which we achieved about a year ago. And there's a number of reasons for that. One is we want to signal to investors that we want impact investors. Yep. So obviously we do want to make a financial return, but we don't want to do that at the expense of integrity and transparency. And secondly, we want to make sure that the team that works on Eargym, it has values that are about making the best product we can for the people that we serve, so to speak. And so we have a small team of about 12 people. We're a remote company, partly because of COVID, because we set up during COVID or at the beginning of COVID, the shutdowns that forced it our hand a bit, but we've decided not to have a physical headquarters because actually that enables us to recruit geographically. It enables us to recruit people who are the best people for the job rather than where they live.
Very modern. Isn't it nice to hear that?
Yeah, it is. Yeah. And also it enables us to recruit people who might have, Andy and I both think work-life balance is really important. We both have big careers and we've both worked ridiculous hours for a very long time. And we've recognized the damage that can do in terms of not only to one's own sense of emotional and mental well-being, but also one's family and friends. Networks. So we're really keen to ensure that we create a work environment where people want to be at work when they are paid to be at work, and that they contribute their best effort in the hours that they work. But for example, we don't clock in and clock off. If we pay somebody to do 35 hours a week, they will do 35 hours a week, and we will trust them to do that. But when they do it,
doesn't matter.
And
I don't care.
And that enables us to recruit people who might have caring responsibilities, who might have other commitments that we need to respect.
Yeah, absolutely. So let me end perhaps with lessons learned, and perhaps what advice you'd give to others thinking about starting a company in the health tech space, especially a little bit later in life. How much risk, including financial, do you need to be ready to embrace, accept? And what other risks do you think come along?
That's a really good question. Andy and I didn't take a penny from the company for the first 2 years. And on aggregate, I think I've probably over the last 4 years earned less than other people in my team. And the reason we did that is because we had a relatively small funding, and we didn't want people at the start of their careers to have to work for free, but we couldn't pay them very much. But it was more important to bring their skills in and respect their skills. We felt that was the most important priority. But undoubtedly, both Andy and I have really had to stretch ourselves financially to get the company to a point where we then got more investment and could pay ourselves. It is difficult to not think about the business and to not think about where the opportunity is. And what advice would I give? I have really enjoyed it. I'm really, really glad that we have taken this step together. But there's no doubt about it, if I had had people who were financially dependent on me, unfortunately wasn't in that position, I couldn't have done this.
Yeah.
It's a huge personal risk.
Yeah, absolutely. So know what you're going to carry. Yeah. So maybe just to end, what future plans for Eargym? Where are you standing? What investment round are you in? Where are today's users and markets, and where are you heading tomorrow?
Yeah, we are.
If all goes well, that is.
Yes, indeed. Thank you. Yeah, if all goes well, then we are raising, we've done 3 small rounds so far. We're now raising a £1.2 million round, so about $1.5 million. And the reason for that is that we are a UK class 1 medical device, and we want to go through the EU medical device process, probably to class 2A, and that will take us about a year, and it's quite expensive. The reason for that is it underpins some really important commercial conversations that will enable us to work with partners that we're working with now to move out into Europe and to Asia. Yep. So we have some very clear steps that we're going for. And we're on a B2B model, so business to business model, because we know that that's the best way to reach the largest possible audiences who need to check their hearing and maybe think about impact on health insurance or, the opportunity over through retail audiology and the like. So yeah, we are raising. If any of your listeners are interested enough to want to know more about how to invest in Eargym, I'd love to hear.
Absolutely. Where should they go? And can I put a link to that source in our show notes? So if they'd like to invest in this venture.
Well, probably the best thing to do is email me directly, but I don't know if I can I give you that?
We will put that into the show notes. So all interests in what I think could be a massive business opportunity, emails to Amanda Philpott. We'll put that in the notes. Amanda, fantastic. Very, very inspiring on all fronts. 1, the technology, 2, the health, and 3, the midlife transition story that you're a great role model of. Thank you so much for taking the time to share it with us.
Thank you so much for having me on. It's been such a nice conversation. I really appreciate it.
I've heard you really well, so I'm reassured that I'm going to go and do my Eargym now.
Good. You do that.
Thank you. See you soon for the next round.
Thank you. Bye.
For more thinking about the impact of our 4-quarter lives, you can read my column at Forbes and subscribe to my Elderberries newsletter on Substack. Let's design lives that aren't just longer, but better.